Welcome back to San Antonio Living. Well, women who suffer from endometriosis deal with pain and excessive bleeding. But do you know if you're at risk? Our friends from the Institute for Women's Health can not only tell you if you're at risk, but they can also help you alleviate those symptoms. Here's Alana with more.
This morning we're at St. Luke's Baptist Hospital OR. We're talking to Dr. Almendarez from the Institute for Women's Health. How are you? Thanks for having me here.
You're very welcome.
I can say this is probably my first interview that I'm doing in scrubs, so thank you. Okay, so today we're talking something that's very important, especially for women. It's endometriosis. What is it?
Endometriosis is a pain and bleeding caused disease in women. It can affect women of all ages, starting at from the time they start their menses to even postmenopausal. It causes bleeding and pain inside the pelvis and abdomen.
Okay, so how is this something like this can be treated? How does somebody know, aside from the pain, how do they know they have it?
Well, the only way to truly diagnose endometriosis is with surgery. We do treat this with medicine, including birth control pills and some specialized injections, but the true treatment involves surgery.
Okay, well, you're actually going to show that to me in a moment, because it actually has to do with, we call a brand new tool, and it's a robot. But who would be at risk for endometriosis?
Well, I think all women who are having a menstrual cycle are at risk. 30% of women in this country will develop endometriosis, and it does run in families. We see it genetically. This is the console of the robot and robotic surgery, and after I am at the patient's side and put the instruments inside the patient's abdomen, I come to the console, and this is where I do my surgery.
Robot, it's really what it is, but it's an extended arm, isn't it?
Yes, there are 4 to 5 arms that we can maneuver inside the patient's abdomen at any one time, and I am looking, directly inside the patient's abdomen at all times, moving the instruments with my fingers and wrists.
Is it safer to use this instead of you doing it yourself hands-on?
Yes, it is. I mean, it allows us to see better inside the woman's pelvis. It allows us to maneuver better, and all of that makes surgery safer and easier for both the patient and the doctor.
Now, if there's any ladies at home that might be having that same kind of pelvic pain that you described, what would you suggest that they do?
I suggest they go see their gynecologist and let them know that they're having that type of pain, and their gynecologist should be able to help them with that pain.
This is the Institute for Women's Health. They're on Floyd Curl Drive, Suite 600. Give them a call, 615-8585. Online, ifwh.org. They also have a Facebook and a Twitter. Shelley, what's going on?
Well,